What do different philosophies teach about moral dilemmas? Imagine facing a situation where you must choose between two tough options, each with its own good and bad points. That's what a moral dilemma is all about. Different philosophies offer unique ways to think about these tricky choices. Let's explore how they guide us in healthcare and everyday life. Deontological ethics, or duty-based ethics, focus on following rules no matter what. For example, a doctor has a duty to respect a patient's right to refuse treatment, even if it might lead to harm. This approach emphasizes doing what's morally right based on principles, not just outcomes. But conflicts can happen when a rule to respect autonomy clashes with the duty to prevent harm. Utilitarianism looks at the results of actions. It aims to do the greatest good for the most people. In healthcare, this might mean prioritizing treatments that help many patients rather than just one. If resources are limited, utilitarian thinking could support giving more care to those with better chances of recovery. Sometimes, this approach can conflict with individual rights, like when sacrificing one person's preferences benefits many others. Virtue ethics centers on the character of the person making the decision. It encourages qualities like compassion, honesty, and prudence. In a moral dilemma, a healthcare provider might consider what a kind and wise person would do. This approach values empathy and personal integrity, helping clinicians navigate complex situations with sensitivity to each patient's unique needs and values. Principlism is a practical framework that uses four main principles: autonomy, beneficence, non-maleficence, and justice. Autonomy respects patients' rights to make their own choices. Beneficence and non-maleficence focus on doing good and avoiding harm. Justice ensures fair treatment for everyone. When these principles conflict, such as respecting a patient's refusal of treatment that could save their life, clinicians must carefully weigh each principle to find the best path forward. Care ethics emphasizes relationships and understanding the context. It reminds us that healthcare decisions aren't just about rules but about caring for the whole person. This approach encourages shared decision-making, respecting patients' cultural backgrounds, and considering their social circumstances. It promotes a compassionate view that values the human connection in resolving moral dilemmas. In real life, these philosophies influence many healthcare decisions. For example, when a patient refuses treatment, respecting autonomy is key, but doctors also want to do good and prevent harm. During end-of-life care, respecting cultural values and patient wishes is vital. When resources are scarce, fairness and justice guide how to distribute care fairly. Engaging families and ethics committees helps find balanced solutions. So, different philosophies teach us that moral dilemmas aren't simple. They require balancing rules, outcomes, character, principles, and relationships. These teachings shape the core principles that guide healthcare professionals every day, helping them make ethical choices that respect patients and promote well-being.